For the 60 million people who call rural America home, Washington just made history with the largest investment in rural health care ever. So we turned to Lynn Barr, a trailblazer and one of the most trusted voices in the field, who believes every American deserves access to world-class care, no matter where they live or who they know. From Ballard Studios in Washington, D.C., it's 13th and Park.
The hard things that are necessary, we either do it or we'll pay the price down the road.
That often is missing in politics.
We have to solve everything.
It's a nightmare.
You and I can differ, but that doesn't mean you and I cannot be friends.
I have faith in the American people.
Those are the facts.
The Illuminati right there. Aliens could have invaded and nothing would surprise me at this point.
We went from North Korea to M&M. That's a lot, man.
What's in this tea?
So Lynn Barr, welcome to 13th and Park. You've been described as kind of a force of nature. And certainly when it comes to healthcare and rural healthcare, that seems to apply. Do you think that's a fair description of you, both as a professional in the field and just personally?
Well, I guess I've heard it enough to say it must be fair. I think that I've just always had a vision for just getting things done, making change in the world, and which is really hard to do. You have to have a lot of passion. You have to lead. It's not a passive activity. So that force of nature is really just trying to make the world a better place, and I'm happy to do that.
So why did you take this force and pivot into healthcare and then specifically into rural healthcare?
I had this experience in my 40s where my husband became ill and passed away. And it was a terrible, terrible 6 months of my family's life. And the healthcare system really let us down. He was terminal, and we could have spent that time together, and he spent it in the hospital. The system was the problem. And so what I did was I thought about it for a long time. I actually spent about 5 years riding my bike a couple hundred miles a week, just thinking about healthcare and what would you do if you could do things differently? How would you make it better for patients? How would you make it better for America? And so I decided to go back and get my master's in public health. And so at 50, I went and I was like the oldest student on campus, UC Berkeley. I was, like I had 8 years of night school. I didn't think they'd let me in, And sure enough, they did. And I went to the School of Public Health to learn how to create health. And it turned out to be a fantastic experience. But then I had to do an internship. And as a, 4-time former CEO, it's really hard to do an internship at a school of public health that, is appropriate, meaningful, et cetera, just not awkward. And fortunately, the Deputy Secretary of Health Information Technology and Exchange for the state of California came in and spoke to our class, our health policy and management class one day, and I followed him out of the room. And I was
that
like,
the aha moment for you?
Yeah, and I was like, hey, because I was very interested in technology. Technology has always been my thing. And so this idea that we're going to get everybody to adopt electronic health records and we're going to get them all to talk to each other, just seemed like I need to help with that. And so I was hired to assist the state of California in developing their plan for health information technology and exchange. And there were 65 rural hospitals. That was one of my constituency groups. And they stood out like a sore thumb. They had no electronic health records. They had no IT staff. I surveyed them all. They had between 0 and 2 IT staff, and that included Bill the cable guy, right? It was like connecting everything by cable, all right? So this is 2011, right? 2010, And so I just saw a tremendous need. I ended up organizing the California rural hospitals to help them adopt electronic health records, and United Health Group jumped in, lent them the money, because first of all, they didn't have the money to buy it, and they get paid back in 2 years.
Right.
They didn't have the cash flow. These guys actually open their checks every day to decide who they're going to pay.
Yeah.
All right, that's the state of rural American health systems.
How many people, when you talk about rural healthcare, how many people are we talking about in America?
About 60 million.
60 million Americans who are in a situation where they depend, and a lot of times their lives depend on the quality of rural health care.
That's right. And that's the size of a good-sized European country, if you think about that. And yet they are kind of off to the side. And, and what I found when I started advocating for this group was that everyone was afraid to hurt them. The idea was they're small, they're weak, we need to leave them alone. And the world has changed since the 1900s, when these hospitals were built, right? And so we can't leave them alone. It is an incredible disservice to 60 million people that we don't modernize our rural system the same way we're modernizing the rest of our health system.
So the big, beautiful bill, which has been much discussed and will continue to be much discussed for quite a while, included something that provided $50 billion for rural health care in America. So you're looking at that, you're probably thinking two things, given your background. What an incredible opportunity, but we got to do it right. If we don't do it right, we could blow this opening and waste a lot of these funds, and then we're back where we started.
That is exactly, I think, what CMS is struggling with and what everyone's struggling with right now. There's never been an opportunity this size in rural America. This is it. And without good implementation, it's going to be wasted. And so what we've seen in the past was $35 billion was the HITECH Act under George Bush.
Right.
95% of all physicians and hospitals now have electronic medical records. It was $35 billion. It was a national program. It was extremely prescriptive. It was very clear. You do A, you get paid B.
Right.
You can do it or not, but if you don't do it, you lose. And then we're still going to make you do it eventually.
Anyway,
right. So you might as well use the money. Right. And that was the national. They gave the same amount of money to the states to do health information exchange. And I was in the room.
Sure.
I was in the room. And regional extension centers were state programs. Health information exchange was state programs. There was so much politics that we didn't do anything with that money. We've seen how we can take tens of billions of dollars and get nothing for it, because today my electronic health record can't talk to your electronic health record.
So my understanding in this $50 billion funding is a lot of that is going to the states. So if you're a state that's getting this potential mass infusion of funding for rural healthcare, what's your advice for what the states should be asking for and what they should start positioning to be ready to do?
Oh, it's a really good question. I mean, first of all, they just need to take a deep breath. I think a lot of the states are very focused on the Medicaid issues right now, and there's just a lot of happening right there, and that this opportunity is going to go away. If they don't have their application, if they get their applications approved by December, they have a guaranteed $100 million a year of funding for 5 years.
And if they don't
get it.
They lose the money.
They lose the money. And even worse, and this is what's going to scare the states off, is that if they don't use the money the way they said they were going to use it, or if they don't use it within 2 years the way they said they were going to use it, they have to give it back.
Oh, the old clawback.
The old clawback.
Right.
And clawbacks are really terrifying for states, particularly because in this opportunity, they get to keep 10%. So that $10 million a year could go a long way towards helping them solve some of their other problems, but they're going to have to spend $100 million a year, and that is not easy.
We talked before this interview about your support for RFK Jr.'s MAHA perspective on healthcare, and that we need to invest more and more in something you've given real thought to, the MAHA Centers of Technological Excellence for Rural Healthcare. Tell us about that idea and why, with this opportunity, maybe a once-in-a-lifetime opportunity, it's maybe time for us to really embrace that.
There's a lot of debate in healthcare policy circles about whether or not chronic care management is valuable, whether the prevention, exercise, diet is really going to move the needle on healthcare. And I think RFK is right for a good reason, is that when Caravan created the national ACOs that we did, right, we focused on one thing, and that was chronic care management. It was the only thing we did. We didn't have a million things we could do or could afford to do. Everybody hired a nurse. They started managing the chronically ill patients in the population. It took us about 4 or 5 years to figure out how to perfect the system of accountability. But once we got everybody doing the work, we saved 3% per year every year. And that is a lot. All right. That is a lot of money. It's not super exciting, right? I mean, a lot of people would love to, people are like 10, 20. And I'm like, you know what? That's not real. I have been arguing with policymakers ever since that this is where we should be focusing. And everybody's like, no, the data doesn't support it. But the data doesn't support it because there's no single view or vision of what chronic care management is. It's not defined. And so people will say they're doing it, and then I'll look at them and go, no, you're not. I mean, we had clients that told us they were doing it, but we had very prescriptive ways of seeing whether or not they were. And if they weren't, getting them back on track. That's how you get these kind of results. And so what excites me about the MAHA Centers of Excellence is that with this amount of funding, $50 billion, $100 million per year per state, we can put technology centers in every single rural community and staff them with people that will manage every aspect of the health of their population. I believe that, honestly, there's a lot of support from rural America for trying different things towards health, for that they believe in RFK's agenda, they believe in the president's agenda, and they're going to want to get in there and try, which is, a motivated patient is 90% of the game, right? Thank you, Mr. President. So let's get in there and enroll them and engage them in their health so that everyone that enrolls would have a plan for their nutrition plan. They would have an exercise plan. They would have a care plan. They would have a preventive plan that makes sense for them.
As opposed to just chronic care. You're talking about the whole spectrum of care now.
Exactly. And that's taking that little bit we did in chronic care and really putting the president's agenda around total health. And I left out behavioral mental health, and that is an important part of this as well. So not only doing all of that work in the community, managing the patient wherever they go, but also creating very tight referral relationships with quaternary care, with maternal programs. We're a maternal desert. We can fix that. If we bring telemedicine into the community as a standard of care, we can deliver care from the best providers in the world in our rural community. And I believe that we will prove, and through the data over the 5 years, we will prove that this is the best way to deliver care in America.
You said we're a maternal desert. That's fascinating. What does that mean?
We've lost maternal care. We don't have OB/GYN. We don't have maternity. Most of the rural hospitals have closed their maternity programs because you've got to have multiple OB/GYNs available 24/7.
Yeah, sure.
We can't do it. They're just not there. So because of that, we've had to close all of our maternal programs. And we have a problem with maternal mortality, and it's worse in rural than anywhere else. But we can solve this with technology.
Yeah.
And this $50 billion gives us the one-time opportunity to create that solution. And the work that we do with those patients will create a sustainable model. So this isn't, you spend it in 5 years and it's gone. By the end of the 5 years, it's completely sustainable.
Is it exaggeration to say, Lynn, that this would make rural America the laboratory for all of America in a new way to deliver healthcare?
That's right. And if we can standardize the programs across as many of these communities as possible, we will have rock solid data that the healthcare system needs, right? Because if you talk to payers, if you talk to providers, they're like, where's the data? We're used to seeing clinical trials. And so we need to prove to America that RFK is right, and I want to be part of that.
What do the decision makers in Washington, D.C. don't quite understand about rural health care that you wish they would? Because if they did, if they really got it, there might be a whole nother perspective. And maybe some of that perspective, to be fair, made its way into the big, beautiful bill with $50 billion of funding for rural care.
I think that what they see are the weaknesses, but they don't see the strengths. I work with a lot of other people that are in, big health systems, and the pain and agony of trying to change those systems when the culture is so entrenched in fee-for-service, it is really, really hard to move into value-based care. And what I found was I could sit down with a rural community, get all of the decision makers around one table, explain why this is a good idea, explain how it's good for their patients, and how they're not going to lose money, and they'll do it.
And you did this when you moved in and created Caravan Healthcare, and you started to help these rural hospitals and these rural clinics all over America as you started to help them. Did you see around that table those kind of the eyes like light up of these people in rural America that said, oh my God, you're right, that will work here?
I think they were a lot more skeptical. No one's ever reported quality in rural America. We're not required to report quality. So we don't even know what our quality is.
Yeah.
Right. And so there was a lot of fear. The physicians were extremely angry about the whole system. I had physicians throwing things at me in meetings, Medicare, you always ask me to do more, pay me less, do more, pay me less, And I'm like, he's not wrong.
Do they feel like the redheaded stepchild in this whole little storyline?
Yeah. And that things are not within their control and
Yeah.
things are being forced on them. And so you had to approach them collaboratively. You had to give them off-ramps and say, hey, you know what? If this doesn't work out, you can go back to doing what you were doing. It's okay. But try this because there's a future here. And I think there's an opportunity for rural America to actually be the best healthcare you can get in this country. We just have to organize it the right way.
4 years ago, you joined the Medicare Payment Advisory Commission. I want to make sure I got that right. MedPAC. How did they find you? And what is it that you're doing? Because I know when you came into this, you really wanted to change the mindset from a volume-based perspective to something that was value-based.
In 2011, 2012, the Affordable Care Act came out and the Medicare Shared Savings Program was out there. And I'd been working with rural providers. I thought this would be a great program for them because they couldn't report quality. They had no way to do it. And so I could put them in a program that they would report quality. They'd get paid, it'd be great. And so I started assembling rural providers and then I worked with CMS and we got the AIM program. The next thing you know, I've got hundreds of rural hospitals that are all working on value-based care and nobody saw that coming. So I started meeting with the executive director and staff of MedPAC. Every year I would bring 5 of my rural hospitals with me and our chief medical officer. It was always his birthday for some reason. And we would meet with Mark Miller and the staff and tell them what we were doing and show them our data and try to, get support from the government to actually try to transform rural healthcare. And Mark was kind enough to write a letter of recommendation. He was the executive director of MedPAC at the time, and he recommended me for the job.
Doesn't a lot of this trace to things that are very personal to you, Lynn? You had a challenging childhood with a mom that was battling addiction. I remember you and I talking about how you would sometimes go to hospitals or other medical facilities and you'd be in the lobby, basically, or in the waiting room, right? And you're taking this all in. Did all those things kind of gel into your motivation to kind of do something significant for healthcare?
Community hospitals, and particularly these rural hospitals, it's the ultimate safety net.
Yeah. You
got the churches and you got the hospital, and everybody has a place to go. And our rural hospitals take care of everyone in the community in a really, really special way. And so it's important for me to give back to kind of a system that was like a constant source of support in a very chaotic childhood.
So you went from those beginnings, those roots, and eventually you joined the military. And as I think we've talked about years into it, you were named Soldier of the Year. So I'm not sure how I connect the dots, seeing a community hospital in action and going through, the real personal experience with your mom to she's Soldier of the Year, right? How did that happen?
It's funny. I have a lot of drive, I guess. A lot of energy.
Force of nature. There you go.
Yeah, force of nature. I think there's a huge personality mismatch between me and the military. I'm an out-of-the-box thinker, and they were just always trying to kind of get me into the box, And so part of it was I ended up competing for Soldier of the Year because I wanted to show my management that, I'm on the team and, I can do this and I can represent, my little company well. And so there was a series of 14 competitions that I went through and finally won that amazing title. It was great because it was like telling me, you have this ability, just keep going.
That same kind of spirit, of course, wends its way into another storyline for you. And sadly, for a lot of people in Hawaii, when a couple of years ago, you had the fires that not only killed 110, 120 or more people, but devastated parts of Maui, including where you were living in Lahaina.
Right.
Take us back into that day when it started with smoke on the horizon, then suddenly you're literally with your husband and your dogs running for your lives.
Yeah, it was such a horrible day. It was a very weird weather day. And so there were 40 to 60 mile an hour winds coming off the hill. I could see the fire from my lanai and I was kind of watching it, and it went out. A few hours later, it came back and the fire department had left.
Like it was over.
Like it was, yeah, and
yes.
left West Maui because there was another fire on the other side of
got
Maui.
Got it.
And so they were gone. The water had been turned off. There was no communication. There were no sirens. People were wondering what to do, and nobody knew. I lived on Front Street, and where Front Street went into the highway, there was a policeman that had stopped all the traffic on Front Street for half a day.
Wow.
And so I was looking in front of my house was the mail truck. Hours later, the mail truck was still there, and the fire was back, and now the fire's coming, and everybody's just still sitting there in their cars. We were pretty much at ground zero for where it hit the coast.
Yeah.
Propane tanks blowing up left and right, and the smoke is like unbelievably toxic. So thick you couldn't see your hand in front of your face. And I'm running past all these people that are still sitting in their cars.
Wow.
Right? And we know how many people died in their cars.
Yeah.
And it was just as we were getting to the highway that they finally let them move. Thank God they did, because those people also, there would have been many more casualties. And why they wouldn't even let them move all day, nobody knows.
On your list of many things that you are already doing and you've already done with your life, is there anything else that when you look back on your life, you're going to say, I kind of did it all?
You know, it's funny because I feel like everything I've done in my life has prepared me for this moment. And so I think what's about to happen in rural America and what is about to happen in Lahaina is my destiny. I will fight for both of those causes as hard as I can, as long as I can, and give everything I can to making those things happen.
I can tell you one thing. Anyone who is in their right mind would not bet against you on either front. Lynn, great to have you with us today.
Thank you so much.
Thanks for coming in.
Thank you.